Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G and I'm so happy that you're here again. Today we are going to talk about skincare, and it's not just the basics of skincare, but this is how I talk to my patients about skincare, and I want to give you just a couple little tips and tricks about language, about how to integrate this into every single patient encounter. And as you know, I'm a triple board certified dermatopathologist, and this is in my blood. I want to understand how things work, why they work, perfect them, and really get down to the nitty gritty of what's in each skincare product and get away from the brand name. So my first point is going to be, what do patients say when they come in and you ask them, what do you put on your face? I use that sentence all the time. What are you putting on your face? Just basic. Well, you know, the response is I use Environ, or I use Revision, or I use SkinCeuticals. And I think to the consumer, they feel happy that they have a quote unquote medical grade, that's a whole other topic, skincare line and skincare brand that they're using. And I first off say, congrats, that's awesome. That's a great brand. They're backed by science, they're awesome. My other response could be, oh, I haven't heard of that brand before. Tell me more. And, you know, if I hear a brand name, I then dive into it deeper and I say, well, that's great. That's a great brand. But what products are you using from that brand? Because there's a whole bunch of them. And I think what I find the most is that patients will be using all of the wrong products for their specific skin from a great reputable brand. So the brand really doesn't mean anything to me. And once I digest that with the patient and say, tell me exactly the products you're using, then you get into the science of it. You get into them understanding that it's not about the brand, it's about the ingredients that are in the products and how can we tweak that. The second point I'm going to make is it's very important not to make your patients feel pressured to buy something from you or something from anyone, because the majority of your patients have already purchased a lot of skincare that costs a lot of money, and you don't want them to feel as though you're trying to sell them something else. That is the antithesis of what I stand for, and that's the antithesis of what you should be standing for. You want to educate them. So you have them list out the products they're using, and if you don't know what ingredients are in them, and if they haven't brought the products with them to the visit, some of my patients do that, or taken a photo, I take the time to look them up online and find out exactly what ingredients are in all of the products they're using. Then I have all of the pieces of the puzzle, and I can understand why they look a specific way, why their skin is a certain way, because of the ingredients they're putting on their skin. And once they understand that you're really there to educate them, the whole conversation shifts, and it's an educational experience for everyone. And a lot of the time my patients will say, wow, nobody's ever told me that. Wow, I never knew that. I felt forced to buy something when I'd already purchased all this other products. And the way you can position it as well is say, you know, I have a couple recommendations that you can either take it or leave it. And everyone gets skincare samples when they come into my office. They can throw them in the trash when they leave the office, and I tell them that. I say, you know, I know you didn't come here maybe specifically for skincare. You get to try this. You can throw it away when you walk out, but here you go. And then the pressure is taken off of the patient. The majority of them, 99.999%, come back 2 weeks later or earlier and say, wow, I'm obsessed. You know, my skin has never been better. You know, it's important to, back to what I was saying before, is if they have given you all of these products that they use and they've spent thousands of dollars, you can say, why don't you decrease the frequency of so-and-so product and just alter the order of application, or maybe use it one in the morning, one at night, or decrease the frequency. So that can help guide them. If there's a product that I specifically don't like for their face and is a reason why they're either red or more rosacea prone or breaking out, I'll say, you know, I would advise you not to use this, but I do appreciate and understand that you've spent a lot of money on it. Maybe use it on your neck or your hands, or just take a break from it. Let's decrease the number of products you're using. Let's simplify it to let your skin heal, because the majority of the time, patients are overstripping their moisture barrier or their acid mantle. And so they're creating damage to their skin cells and that barrier that creates moisture leakage, water loss and they're dry and chapped and irritated, and then subsequently can develop conditions like atopic dermatitis, eczema, perioral dermatitis, rosacea. And from those conditions, you can develop hyperpigmentation. So it's a cascade effect, and even acne. So those were a lot of points there, and I hope you followed along with that. The other thing that I do is having the products visually on a wall is great. People can see how pretty they are. They look nice, hopefully. But that's not enough. So I have patients feel the products. I put the products on their hands, on their face. They want to feel them, and they want to have them on their face for maybe the duration of our consultation to see how they feel, how they look. And one of the biggest issues I have and why I do this is with sunscreen, because many patients will say, I don't use it, or they'll say they use it and they really don't, and they wish they could use it every single day. And the biggest thing is this is not a sprint. This is a marathon, and we need to use it every single day, but we also need to really like our product. So we need to disassociate the word sunscreen and the feeling and smell of sunscreen with the actual product. And so a lot of patients come in, they have amazing sunscreens, and I'm like, oh, that's great. Between 30 and 50 SPF, broad spectrum, multiple oxides, a physical sunscreen. And I'll say, well, that's awesome. I love that one. Here's another one for an option. And I just put it on their hand and they feel it. I say, if you ever run out of that, here's an option, just because everybody likes options, but you're using a great one. So compliment your patients on the good things they're doing, because a lot of them are doing really great things. And then get into the nitty gritty about ingredients, get away from brands, understand why they look the way they look and what their concerns are. And I hope this helps. I hope you enjoyed this quick little snippet on skincare and a couple of my pearls. Hit like, comment, subscribe to my channel, share it with your friends, and I can't wait to see you next time.